Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Emergency room versus urgent care. Introduction. If you get sick or hurt, you may need medical help. It is important to understand when you should go to urgent care and when you should use emergency medical services. This program explains the differences between the emergency room and urgent care. It helps you understand when and where you should seek medical care for certain types of illnesses or injuries. What is urgent care? Urgent care clinics are available to treat medical conditions that are not life-threatening. These clinics may be attached to a hospital or may be separate facilities. Urgent care clinics are not equipped to deal with major medical traumas or severe conditions. In these situations, a visit to the emergency room is more appropriate. Some conditions that may be treated at urgent care clinics include broken bones without outside wounds, colds, coughs, or sore throats, eye, ear, or skin infections, fever or flu-like symptoms, minor burns, scrapes, or cuts, sprains or strains. Urgent care clinics can also treat some infections. These include respiratory or urinary tract infections. If you cannot get a same-day appointment with your primary health care provider, an urgent care clinic can help. Urgent care clinics have longer open office hours than most primary care clinics. Most urgent care clinics do not require appointments. Instead, a person can just walk in and ask to be seen by a healthcare provider. When is it an emergency? Emergency rooms, or ERs, are designed to treat potentially life-threatening emergencies. They are open 24 hours a day. Examples of conditions that should be treated in an ER include chest pain, difficulty breathing or shortness of breath, head trauma or other major trauma. Other conditions that should be treated in an ER include loss of consciousness, severe or uncontrolled bleeding, sudden loss of vision or blurred vision. Other reasons to go to the ER include any sudden or severe pain, confusion or changes in mental status, difficulty speaking. Other reasons to go to the ER include severe or persistent vomiting or diarrhea, sudden dizziness or weakness, suicidal feelings. You should also go to the emergency room if you are coughing up or vomiting blood or have upper abdominal pain or pressure. If you have a serious condition, go to the nearest emergency room. Do not take a chance with any conditions that may be life-threatening. For some emergencies, you need emergency services where you are located. Emergency medical technicians, or EMTs, do specific rescue jobs. They answer emergency calls, drive ambulances, and give basic medical care. Some EMTs are paramedics. This means they have training to do medical procedures on site. They usually drive you to the ER for more care. If you or someone you know needs emergency care, go to your hospital's emergency room. If you think the problem is life-threatening, call 911. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Differences in care. Urgent care clinics and emergency rooms have more differences than just the conditions they treat. They also differ in length of waiting time, services offered, cost. Urgent care clinics often have a shorter waiting time than emergency rooms. This is because at the ER, life-threatening conditions are treated first. If you have a non-life-threatening condition, you may need to wait for a long time to be seen. Urgent care clinics often treat people on a first-come, first-served basis. An urgent care clinic offers different services than an emergency room. For example, some urgent care clinics may have the equipment to perform X-rays or simple blood or urine tests. Emergency rooms have access to more equipment, including CT scanners and MRIs. A visit to an urgent care clinic also costs much less than a visit to the emergency room. This does not mean you should not go to an ER for life-threatening conditions, but conditions that can be treated at an urgent care clinic will cost you less to be treated at such a facility than at an ER. If you visit an ER for a non-life-threatening condition, your health insurance plan may not pay as much. You may be responsible for more of the costs. How to decide? If you are unsure about whether you should go to an urgent care clinic or an emergency room, you can call and ask a healthcare professional. If your primary healthcare provider's office is still open, you can call and ask them what action to take. They can advise you where to be seen based on your symptoms. You may also call the urgent care clinic nearest to you. The clinic can tell you what conditions they treat and if you should go to an emergency room or call 911. Some healthcare facilities have a call line so that you can talk to a healthcare professional, such as a nurse. If you have questions about where you should be seen, you may be able to call this line and talk to a healthcare professional. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. If you get sick or hurt, you may need medical help. It is important to understand when you should go to urgent care and when you should use emergency medical services. There are many differences between the emergency room and urgent care. The facilities differ in the types of illnesses and injuries they treat. They also differ in length of waiting time, services offered, cost. Getting treated at an urgent care clinic for non-life-threatening conditions may save you time and money. But if you have a serious condition, go to the nearest emergency room or call 911. Do not take a chance with any conditions that may be life-threatening. Thank you for using Explain.